Deep inside a cave on Borneo, archaeologists uncovered the skeleton of a young person. At first, nothing seemed unusual. Then they looked at the left leg. The lower part was missing. Not torn away by an animal, not shattered in an accident, it had been deliberately removed. 31,000 years ago, someone performed an amputation. There were no hospitals, no anesthesia, no antibiotics, only stone tools. And somehow, the patient survived. Not for a few days, not for a few weeks, for another 6 to 9 years, which raises an impossible question. How could Stone Age humans perform surgery, thousands of years before medicine even existed? The operation on Borneo tells us something remarkable. Removing a leg is only half the battle. Keeping the patient alive is much harder. The bleeding has to stop. The wound must stay clean. The broken tissue has to heal. And someone has to care for the patient for weeks, or even months. That means ancient surgery was never just one person holding a sharp stone. It required knowledge, planning, and experience passed from one generation to the next. Nobody understood bacteria. Nobody knew what caused infection. But they could observe. Some wounds healed, others rotted. Some plants eased pain, others made things worse. Little by little, observation became knowledge. And that knowledge led humans to attempt an operation even more unbelievable. One that required opening the human skull itself. Across the world, archaeologists have discovered thousands of ancient skulls with carefully made holes. Europe, Africa, Asia, North and South America. At first, scientists thought these were battle wounds, until they noticed something extraordinary. The edges of the holes had healed. Bone only grows back if the person survives. Some patients lived for years. One skull from ancient Peru even shows evidence of multiple healed trepanations. The same person returned for surgery, again and again, and survived. This was not a desperate experiment. It was a procedure people trusted. But how do you cut through a skull without killing the person underneath? The answer begins with one of nature's sharpest materials. When people hear the words Stone Age surgery, they imagine rough tools, jagged rocks, brute force. The reality was far more surprising. Many ancient surgeons used obsidian, volcanic glass. When obsidian breaks, it forms an edge so incredibly thin that even modern surgeons have experimented with using obsidian blades for extremely precise incisions. To the naked eye, it's just a black stone. Under a microscope, its cutting edge can be finer than a conventional steel scalpel. Ancient surgeons weren't smashing through the skull. In many cases, they slowly scraped the bone away, layer by layer, hour after hour, stopping just before reaching the membrane that protects the brain. Too shallow, and the operation failed. Too deep, and the patient died. This wasn't luck. It demanded remarkable precision. But precision alone cannot explain the biggest mystery. Even a perfect operation means nothing if the patient dies from infection a few days later. So why were people willing to take such an enormous risk? No one left written instructions, so archaeologists have only the evidence and 3 leading theories. The first is the oldest: spirits. If someone suffered seizures, heard voices, or experienced unbearable headaches, people may have believed something evil was trapped inside the skull. The hole became a doorway, a way to let the spirit escape. It sounds strange today, but in a world without neuroscience, it was a logical explanation. The second theory is surprisingly modern: trauma. Stone Age life was violent. Falls, animal attacks, hunting accidents, blows to the head. A fractured skull can push broken pieces of bone inward, compressing the brain. Today, neurosurgeons sometimes remove part of the skull to relieve dangerous pressure after severe head injuries. Ancient surgeons may not have understood why it worked, but they could have seen the result. Some patients improved. The third theory is chronic pain. Migraines, epilepsy, neurological disorders. Conditions that ancient people couldn't explain, but desperately wanted to treat. The truth is, all 3 explanations may be correct. Trepanation wasn't one operation performed for one reason. Different cultures probably used it differently. Sometimes as ritual, sometimes as emergency surgery, sometimes as medicine. And that makes the next discovery almost unbelievable, because in many cases, it actually worked. The greatest surprise isn't the operation, it's what happened afterward. Archaeologists can tell whether someone survived trepanation by looking at the edge of the opening. If new bone begins to grow, the patient lived. And they keep finding healed skulls, again and again. In ancient Peru, surgeons became so skilled that later trepanations showed dramatically better outcomes than earlier ones. Researchers believe that in some communities, long-term survival may have reached around 70 to 90%. Think about that. A person has a hole cut into their skull using stone tools, thousands of years before antibiotics, and still survives. How? Probably not because ancient people understood infection, but because they understood experience. They learned which patients had a chance. They learned where it was safer to cut. They learned that cleaner wounds healed more often. Every success taught the next healer something new. No medical school, no textbooks, just thousands of years of observation, passed from one generation to the next. And eventually, those lessons stopped living only in memory. They were finally written down. For thousands of years, everything depended on memory. A healer learned from experience, then taught the next healer. Nothing was written down. If that person died, their knowledge could disappear forever. Then, something changed. Around the 5th century BC, a Greek physician named Hippocrates wrote one of history's first detailed guides to head injuries. It wasn't mythology. It wasn't a collection of rituals. It was a manual. He described different types of skull fractures, explained when trepanation might save a life, warned surgeons where not to cut. He even advised them to cool their drilling tools, because heat could damage the bone. That detail is remarkable. It shows that surgeons were no longer relying only on tradition. They were observing, testing, improving. Knowledge had finally moved from memory onto paper. And once that happened, medicine could begin to grow much faster than any single lifetime allowed. The most surprising part of this story is not that ancient people performed surgery. It's that they kept making it better. A child survives an amputation in Borneo, centuries later. Surgeons across the world are opening skulls and many of their patients recover, eventually. Physicians begin writing down what works and what doesn't. Modern surgery wasn't invented overnight. It evolved. One successful operation at a time, one observation after another, one generation teaching the next. Long before people understood bacteria, they had already discovered one of medicine's most powerful ideas. Experience saves lives. When we picture the Stone Age, we imagine people struggling to survive, running from predators, making fire, hunting with spears. We rarely imagine surgeons. Yet somewhere, more than 30,000 years ago, someone looked at a badly injured child and decided not to accept death. They picked up a stone blade, tried something no one should have survived, and somehow, it worked. Thousands of years later, other healers were opening skulls with astonishing precision. Eventually, those hard-earned lessons became medical textbooks. The first surgeons never wore white coats. They never entered an operating room. They never heard the word science. But every patient who survived made the next operation a little less impossible. And perhaps that's how medicine has always advanced, not through miracles, but through people brave enough to try, careful enough to learn, and wise enough to remember.